Have you ever wondered if the birth control pill your doctor prescribed is actually masking deeper health issues? Today, I sit down with Dr. Monique Ruberu, a holistic gynecologist and founder of Natural Women's Health. As a board-certified OBGYN, she shares why she completely transformed her approach to treating hormonal issues, moving away from simply prescribing birth control and instead focusing on uncovering the root causes of symptoms. You'll learn how to identify symptoms of hormonal imbalance, understand what your menstrual cycle reveals about your health, and explore natural approaches that support long-term healing. Dr. Ruberu explains the connection between gut health, stress levels, and hormones, and how many common reproductive issues may be linked to estrogen dominance. Stay until the end as she shares how simple lifestyle changes can significantly improve hormonal balance. Let's dive in. Hello, everyone. I'm Dr. Katie Deming, and this is the Born to Heal podcast, where we share practical tools and knowledge to help you create conditions for true healing in your life. Let's welcome today Dr. Monique Ruberu, founder of Natural Women's Health and holistic gynecologist. Welcome, Dr. Monique.
Thank you so much. I'm so excited to be with you.
I've heard through the grapevine that you say oral contraceptives suck. I really want to know why. Tell me why. Tell us why.
The thing with oral contraceptives is that they're truly a Band-Aid and they cause so many issues. I was trained as a typical gynecologist. And so in our training, we were taught to use contraceptives for pretty much anything. So if you have abnormal bleeding, if you're having any sort of hormonal dysfunction, if you are having PMS symptoms, if you're trying to avoid pregnancy, like you name it, that was the treatment of choice. And I practiced like that for a really long time. But when I finally began to understand exactly how it functioned, that contraceptives actually just shut things down, they don't allow you to address the underlying issues, then I completely changed my mind about them. So many side effects and so much better, there's so many better ways of addressing all of these issues by getting to the root cause. So yes, I absolutely believe that they suck. I would never, ever, ever, ever write them again.
Wow. Well, and that's really saying a lot for someone who is trained in Western medicine and obstetrics and gynecology, because it's a huge part of what you're trained to do.
That's absolutely true. And it was, I think for the longest time, even though I was kind of a more holistic person, I was raised in a family where we always went to vitamins or herbs or like treatments from our home, rather than going to antibiotics first, or rather than going to allopathic medicines first. And so when I became a gynecologist, it didn't really sit well with me. I think I used them personally for a very short period of time. And even then I was like, I don't want to do this. And for my patients, I always kind of felt like, this is all right, but it's so boring as a physician to just constantly prescribe contraceptives. It takes all the fun out of the detective work of being a physician, right? Trying to figure out why something is going wrong. But on top of that, once I learned that you could actually properly evaluate a woman's cycle, you could check hormones at the correct time, you could figure out that each part of their bleeding pattern actually means something, their length of cycle, their mucus, that all of these different signs and symptoms that they can pay attention to can tell you like a book's worth of information about this patient in about 5 minutes. Once I had that sort of knowledge under my belt, there was absolutely no need for contraceptives, because it just made so much more sense to understand what was actually going on and then to treat those issues so that people could improve their symptoms without the side effects of contraceptives, like estrogen dominance, increased risk of cancer, blood clots, all that sort of stuff.
Yeah. Well, and it kind of reminds me of like in dermatology where they're like, well, it's a rash, so we'll just do steroids. Right? And so I think that And this is the whole reason why I left Western medicine and am practicing in a holistic manner. I too was frustrated with this approach of just dealing with the problem with more chemicals rather than understanding the underlying cause of what is causing the problem. So tell us a little bit about, like, how do you go about assessing someone to understand what's going on with them so that you don't have to just knee-jerk give oral contraceptives to just, solve the problem on a superficial level?
Yeah, this is like the best part of my day every single day, because it's so much fun to be able to just sit there and ask people basic questions, and then you can totally piece it together. So for instance, somebody comes in and they're complaining that they're having abnormal uterine bleeding, that they're bleeding really heavily. So the first thing that I do is I would ask them, okay, how many days are you bleeding, including spotting? And so they would likely say, oh, maybe like 7 days. And so straight away, I know, okay, 7 days is actually long. People typically, when their bleeds are normal, they aren't bleeding more than 5 days. And then I'll say, okay, the first day of your bleed, what are you using? Are you using tampons, pads, cup? And then they'll tell me, typically it's like the first day might be spotting. So they'll maybe use a pad. And then I'll say, okay, when you're wiping yourself with that spotting, since you're not collecting much, is it brown or is it red? And then they'll say, maybe it's brown. So if they have several days of brown leading up to their period, that in and of itself is a sign of endometriosis. Then we go into the first day, and they'll say, or the first day of like true bleed. And I'll say, okay, what are you using? Well, I'm using a super tampon, and I'm filling it in like 1 to 3 hours. So already I can straight away know exactly how much they're bleeding, because a super tampon is like using 2 regular tampons. And if you're filling 1 regular tampon in 1 to 3 hours, you already have very heavy bleeding. So if they're filling like 2 regulars in 1 to 3 hours, they're having very, very heavy bleeding. So straight away in my mind, I'm thinking, okay, either you've got a bleeding disorder or you've got estrogen dominance. So then we keep going and we go through the entire, 7 days. What exactly is your bleeding pattern the whole time? And most often it's like very, very heavy, very, very heavy, very heavy, heavy, moderate, light. And then they'll have tail end brown bleeding at the end of their cycle. And that tail end brown bleeding at the end of the cycle is either a sign of lower levels of progesterone, or it's a sign of a mild infection inside of their uterus. And then we talk about, okay, that's great. Then do you ever see any sort of, stretchy mucus when you wipe yourself? Yeah, I do. I tend to see that quite a bit, like all the way through my cycle. Well, that's another sign of estrogen dominance, because it's the estrogen that hits your cervix and causes you to create that mucus. So if you should only have, maybe 5 days of this, but if you're having it every single day, then that's not the best sign. And then you find out what is the full length of cycle. So from the first day of your period to the first day of your next cycle, going back 6 cycles, what is that range? And so if they have cycle lengths that are longer than 29 days, I start thinking about thyroid dysfunction, PCOS. If they're having cycle lengths that are shorter than 27 days, I start thinking about lower levels of progesterone, going back and asking them, how old were you when you first started having your periods? Oh, I was about 14. Well, 14's a little bit late. So were you an athlete? No, I wasn't an athlete. Well, if you weren't an athlete, then already I'm thinking from that age itself, you probably had some hormonal dysfunction that was never picked up on. And if it had been addressed back then, you probably wouldn't be where you are right now. So just asking those basic questions gives you so much information. It takes about 5 minutes to get all of that. And then straight away, okay, this person absolutely they need a full thyroid panel. They'll need to have, make sure that they're not anemic. So a CBC and bleeding studies and an iron panel. This person needs an ultrasound. And the interesting thing is, when I was taught to check ultrasounds in OBGYN, there was never anything about the timing of when you should check an ultrasound. But in reality, like even radiologists don't pick up on this. If you don't check a OBGYN, GYN ultrasound on day 5 to 7 of the cycle, there is no way that you can tell if the lining is truly thickened, if the ovarian cyst is truly abnormal, because it's only on that day 5 to 7 that everything is quiet. You know, the lining should only be 5 to 7 millimeters. You know, there shouldn't be any cysts present. So if there is anything present, you know it's abnormal from the cycle before. And so little things like that just help you to understand exactly what is going on. And then if you can get them to start charting their cycles and identify exactly where they're ovulating, that's the key, because that's where you know, okay, if I check their estrogen and progesterone 3 days later, 5 days later, 7, 9, 11, I know exactly what the normals should be. So if you know what the normals are, you can get them to check labs and you can compare it to the normals. And then you have an understanding of if they have high estrogen, low, high progesterone, low, and then you can address it.
Yeah. Well, and what's remarkable is that what you're describing, most OBGYNs don't practice that way.
Right.
Which is shocking, right? Like that to me. So you not this way, the way that you're practicing and looking at the bleeding, the patterns of the bleeding, and then the timing and all of this, is this that you basically learned this after your training, after you were already practicing as a GYN?
Yeah, exactly.
So why is that? Like, so is it just because basically most of what they do is prescribe oral contraceptives for any problem, and that's going to solve it and regulate it?
Well, they believe that's going to solve it and regulate it. In reality, it doesn't really solve anything. But because contraceptives are so entrenched in how we're taught, in how we practice, they don't feel the need to talk about what is normal, what is truly normal. Like when you talk to a gynecologist about normal cycle lengths, they come up with something crazy like, oh, 21 to 38 days is normal. And it just depends on you. It's like you're normal. And I'm like, no. Like just like anything else in the world, there is a normal and there is an abnormal. That's how you know, like if something is wrong, by understanding what the normal is. But that was never taught to us, that like low progesterone. I'll never forget patients asking me, I have this brown bleeding at the end of my period. Is that okay? And I was talking to the attending, and the attending was like, oh no, that's just old blood. And that stuck with me. That's what I was telling everybody until I learned this. And I'm like, what do you mean? Tail end brown bleeding means low progesterone. What do you mean that increases your risk for preterm delivery and miscarriage? It's just insane. Like, do you realize, Katie, there is no such thing as unexplained infertility. Like that's a complete lie. There's nothing like that. There's always a reason. And usually when I have patients that come to me for unexplained infertility, I find at least 3 reasons straight off the bat, like in the first 5 minutes. But it's crazy because everything is so entrenched in contraceptives and covering things up, the OBGYNs, the REIs, nobody has been taught what these basic things mean and how to address them. It's crazy.
It is crazy. It's crazy. And I can see why you say that oral contraceptives suck. So it makes sense. I mean, because it's like the baseline, it's just everything gets covered up with that. So then you're really not understanding. And it makes sense why so many people are confused. And also with infertility and all of that. So you see people who've been working with infertility specialists and they have unexplained or no cause, and then they come to you. And when you look at their cycles, you're able to identify that, oh, there always is a cause. There's always something going on.
Every single time. I've never, ever, ever met a patient and like half of my practice is infertility. I've never met a patient who has fertility challenges that doesn't have at least like 2 to 3 causes. And that's just the woman. Like when you start to evaluate the man, like that's an entirely different person who is responsible for 50% of the fertility. And the only test that they're ever given is a semen analysis. Like they never think that maybe their thyroid function would play into this, or maybe their insulin resistance would play into this, or it's crazy. So I think it all comes down to who's making the money, right? So contraceptives are very lucrative for all sorts of people. So contraceptives are a machine, and they continue to come out with new ones, and they continue to give new treatments like this, things that just shut down symptoms rather than address the root cause. IVF is super lucrative. And, it's very easy to do a baseline evaluation of a woman, even if you do like surgical evaluations of the woman, and then to look at the man and say, well, based on IVF standards, your semen analysis is completely normal, so you're fine, and just go from there. But when you actually look at the IVF standards of semen analysis, because they're just picking one sperm out and they're putting it in a petri dish, you don't need very much for IVF standards. So when you compare that to what you actually would need to naturally conceive, it's completely different. Mm-hmm. Like we need way more as far as motility, morphology, concentration, and a semen analysis.
And so when you would evaluate someone for infertility, would you be doing evaluation of both, or you would recommend that the male goes and has that by a physician who can look at these other pieces as well?
So we have like a male fertility program where we would let them know exactly what tests need to be done. And then we would help them to access those as well. So give them, I want them to have the exact same workup as far as, their thyroid function, especially. And like, I remember allopathically, when I was taught to evaluate a thyroid, all it was a TSH and a free T4. But then after moving away, like when you crack that door open and you start looking outside of that box, then you start to realize that there is just so much more out there that you can offer patients. And so when I realized that a proper evaluation of a thyroid is like a TSH and a free T4 and a free T3 and an iodine and a total T3 and a reverse T3 and thyroid antibodies, and then you put all those pieces together and you can see that somebody could have a normal looking TSH and free T4 and have horrible thyroid function. It makes so much more sense for you to have every single person have this full panel so you can actually see what's going on. And I don't feel like 90% of the population ever gets that panel. And so they're feeling like they have thyroid dysfunction, but it never gets addressed because we're like, oh no, your TSH is normal. And the normal range for TSH is so different from the integrative range of normal for TSH, right? Or the optimal range.
Right.
So it's really quite a shame.
Yeah. Well, and I think what you're highlighting is when you really want to understand what's causing the problem, you need more information. You can't just take these very superficial markers and then give a medication to, you can. This is basically the whole system that we both have moved away from. You can, but the problem with that is then we're not making people better and we're just basically covering up. And then those problems accumulate because then you've got problems with your thyroid, which leads to other problems.
The other thing that both of us likely realized is that in allopathic medicine, when I was trained, it's very much a compartmentalized medicine, right? You're the gynecologist, you take care of the ovaries and the uterus and the cervix. Stay away from the gut. Stay away from the liver. That's not your specialty. You should never be talking to anybody about anything other than gynecology. But once you start to realize that everything is connected, right? Like if you have constipation and really horrible gut function, there is no way that you're going to be able to cleanse your body properly to be able to eliminate the toxins that your liver is trying to package up and put into your gut to get out of your system. And then all of those toxins are going to keep circulating in your system. And all of that toxicity is going to increase your inflammation and increase your cortisol levels and mess with your thyroid and mess with your hormones and cause cancer and all of those things. And it's just that whole, how are all these symptoms related to one another? It's not just like separated by these walls and they don't interact. They're interacting all the time. Yeah. And so that I really felt like I missed that in allopathic medicine. And now as a holistic gynecologist, it's all I ever think about. I'm like, okay, well, what's going on with your gut? And they're always shocked. They're like, why are you asking me about my bowel movements? I'm like, it's only the most important thing in the world.
Exactly. Yeah. Well, and especially in the cancer space, the microbiome and the gut is everything. So yeah, I mean, everything ties back together. And I think this is part of what perpetuates the prescription, the business of medicine, is when you compartmentalize, then it makes sense to give, specific pharmaceuticals. But when you start to see the connections and how it's all connected and required to have each piece functioning properly for the whole, then you don't need medications. Once you understand like what does the body actually need and what are the different, how does it all work together, the different organs, I think you're playing a different game. I mean, that's what I feel like now that I'm practicing in this different way. I feel like I'm actually doing something that's like a completely different endeavor than what I was doing before. And do you feel that way too?
100% agree with you. And it's so interesting because I find that things that I never even would have thought about are becoming my greatest tools. And they're so inexpensive, so accessible to every single individual. Things like Wim Hof breathing and cold exposure. I mean, when you really step into that realm, there is so much that you can do as far as lowering inflammation in your body, addressing pain, getting rid of toxicity, jumping on a trampoline, dry brushing. Like, these are all things that I never even imagined would be helpful as far as, medicine and helping to heal people. But they are just such wonderful aspects of care that you can share with people so easily. And they're so, so, so accessible for every single patient that, like, everybody's got a cold shower. They might not have a hot shower, but they've got a cold shower, So.
For sure. So one topic that I wanted to ask you about, and you brought up when you were first talking about your assessment, is estrogen dominance, because I think this is something that a lot of women worry about. I'm wondering if you can tell us, what is that? And then what are signs of that?
Sure. So, what's really interesting is I like to try and listen to other gynecologists' podcasts and whatnot. And there was actually a podcast where this physician was going on and on about how estrogen dominance is not a thing, and that it's just a lie because the estrogen levels rise and fall throughout the cycle, and there's no way to evaluate for estrogen dominance. And then I realized that the reason she was saying this is because in allopathic medicine, you're not taught how to evaluate hormones at the correct time. So she had never understood that there truly are normals. So if you can identify exactly where you're ovulating, and then you check those estrogen levels at the correct time, so either leading up to the point of ovulation or from the point of ovulation until your next period, there are definite normals for estrogen. There's definite normals for progesterone. And so when you look at those, and if you have somebody who has estrogen levels that are high above that, that is where I would say you have estrogen dominance. And so when you have estrogen dominance, typically what you see is these people, it's not necessarily that they themselves are estrogen producers. So it's not like they were innately born with this capacity to pump out tons of estrogen, unless they're like morbidly obese and the fat is constantly converting all of this stuff to estrogen. But if they're, typical sized and they're just somebody that has estrogen dominance, more often than not, it's more of an issue with their gut. They're a person that is not able to cleanse out, or an issue with their liver, a person that's not able to package up the toxins, the excess estrogen, get it into the gut and get it out of the system. So they continue to suck it back and suck it back and suck it back. And then it just builds and builds and builds in their system. And the symptoms that come along with this are fibroid uterus, heavy bleeding, polyps growing in the lining of the uterus, polyps in the cervix, endometriosis, painful periods, pain during the time of ovulation, PMS symptoms. So it's so much of this is all tied together. All the biggest issues that women experience and complain of, oftentimes it has to do with estrogen dominance. Ovarian cysts.
Yeah. And let me ask you this. So where do you start with someone like that? With, if thinking about the gut and this is really interesting because this is, a lot of my practice is focusing on the gut and then detoxification with the liver.
Exactly.
And I love that I love that you're talking about this because I think people don't connect this. They don't think it's connected.
So the first thing that I do is I talk to them about coffee and caffeine. And my advice, which is not very popular, is to get rid of every bit of caffeine. And simply because caffeine acts as a diuretic, it makes you lose your water, and then you end up sucking back your water from your gut, and you end up sucking back toxins, and those keep building up. So it's very difficult, even if you're drinking the right amount of water, which would be half of your body weight in ounces of water every day. It's very difficult to not be dehydrated in that situation, even if you're just drinking like half a cup of decaf, which has 30% caffeine. So that's the first line of defense. Then it is making sure that they're having excellent bowel movements. But sometimes, even if you think you're having a good bowel movement every day, sometimes you just have this buildup of stool in the colon, and it's just kind of sitting there. And you can have stool that's passing out in the middle of that, and you think you're having good bowel movements, but there's just the stool that's plastered along the sides that continues to seep back all these toxins. So I actually talk to patients when they have estrogen dominance about colonic hydrotherapy and utilizing colonic hydrotherapy twice a week for 4 weeks to completely cleanse the gut and then replenish with good microbiome and probiotics and eating the right foods and whatnot. And I'm always amazed because when they do that, we see a radical drop in estrogen for those patients. And that to me is like the fastest way to like kickstart this cleanse. Then you want to, continue doing things like celery juice, warm water with lemon first thing in the morning, if you can tolerate those things, castor oil compresses on your liver. Those are all great ways of cleansing the liver, but modifying your diet so that you're minimizing the inflammatory things that are going in. Another one that you and I have spoken about is the use of the salts. And you're the one actually who introduced me to the purple bamboo salt. So now I've been sharing that with a lot of my patients as well. But that makes a lot of sense, utilizing a salt, because that sodium has the ability to bind a lot of toxins and get it out through your bladder, but also in those and that's what your adrenals need to be able to function optimally. So that's kind of where I begin. I also have them look at what are you putting on your skin topically? Are there any xenoestrogens in those things? What are you using to store your food? Are you putting plastics in the microwave, plastics in the dishwasher? Are you eating foods that are high in estrogen, like soy? Yeah, I always recommend, as much of a whole food, raw type of lots of fruits, lots of vegetables. When you're eating animal protein, always smaller amounts, grass-fed, organic, just to not saying that they have to go on a vegan diet by any means, but just making sure that they're supplementing with a lot of high nutritious, high density, just really great vitamin, mineral filled foods rather than eating the processed stuff. So that's kind of where I start. And then we would follow, once okay, this is your peak day, you can continue to check on a monthly basis. Okay, just one level on peak +7. So you know what that normal is. And you can see, okay, is my estrogen improving? Is my progesterone improving? Also, when you look at the thyroid and you have a lack of iodine, when you give iodine back and get to an adequate iodine level, that iodine also has an impact on the breast as well as on the ovaries. And so there's a definite tie there between the iodine and the estrogen. because when you get adequate iodine levels, you can actually reverse fibrocystic breast in the tissue, and you can reverse ovarian cysts. So that tells me that it's decreasing estrogen dominance as well, at least the impact of it.
Yeah, no, absolutely. And there's definitely that tie-in between thyroid, iodine, and breast disease specifically. So
Yeah.
that is one thing that one of my mentors, said just in passing. He was like, have you noticed that basically every woman with breast cancer also has thyroid? And it's not literally every woman, but I started to really pay attention.
Yeah.
And I was like, he's right. There is definitely, and I really think it's related to iodine. And Dr. Brownstein, who
Yeah.
talks about this, I think is such a valuable resource for breast health. Really is dependent on having adequate iodine within our system.
Yeah. It's really, I mean, it's just so amazing how it's all totally tied together and it's all interlaced. And when you start to improve one area, it impacts every other area and other things get better. Well, I was really amazed. Like I've been doing this Wim Hof breathing and the cold exposure for the past 3 weeks, and just personal experience of, I'm heading into my 50s and I had like my first like long cycle, and I was anticipating, wow, this is now almost double the length of my typical cycles. So I was anticipating I'm probably going to have a much heavier bleed, and it's probably going to be more of like a hemorrhage type bleed. And I was preparing myself for it. But because for that same duration of time, those past 3 weeks, I had been doing that Wim Hof breathing and the cold shower every day, I was amazed. Like it was the best period that I've had. It was like painless. The bleeding was completely normal. It lasted for the same amount of days or maybe a little bit less. And I was shocked because I was not anticipating that at all.
Yeah.
So
it's incredible how like things that you can do that seem, how is that going to affect my period, that it can be so beneficial.
yeah.
Yeah. So go ahead.
No, I was going to say the person who taught me about the Wim Hof breathing, my breathing coach, she was saying that Wim Hof himself and his people are doing studies on endometriosis, which makes so much sense. And they have seen such great responses in women with severe endometriosis and pain when they do the combination of the Wim Hof breathing and the cold showers. It just radically decreases the cortisol levels and the cytokines and it probably increases the good cytokines, but reduces the ones that cause pain. So,
yeah, no, that's incredible, because I didn't know that the connection with Wim Hof and cold plunge related to endometriosis.
yeah.
So
I was totally surprised when I heard it, because I had always thought of it as, okay, this is a way that you can get more energy and you can have more strength and you can just be a stronger person and your immune system can be boosted. But never had I related it to GYN issues or pain or endometriosis. But yeah, their studies are pretty convincing.
that's incredible. So you started to touch a little bit on the perimenopause and menopausal symptoms. And this is like, most of I care for mostly women, and most of them are in this range. And this is the big question and things that come up for people, is managing through shifts in hormones and working through menopause. And I know we could probably spend multiple hours on just this topic, right? So it's like just a small topic to just bring up. But I'm wondering if there are things that that you're seeing. One of the things that I'm seeing is a lot of women struggling really with menopause and going through it. And
Yes.
I'm wondering, is that different than it was in the past, or is it just because now I see more women who are going through that, or is there really something happening that's making it harder for women to make that transition?
So I think I don't. Okay. So I definitely agree with you. This is like the majority of women that have been struggling with their health. When they hit menopause, they're in a far worse place than somebody who has kind of been cruising along. The stress level is huge, right? So a woman who has never prioritized herself, has always cut down on the amount of sleep that she has, is completely stressed out, running from one thing to the next, burning the candle on both ends, that woman is going to have a much harder time in menopause than somebody else who is much more chill and definitely does some self-care, make sure that she gets some sleep. And the reason for this, I believe, is that when we were created, we weren't intended to have our ovaries providing estrogen for eternity, right? Menopause happens for a reason, and the ovaries, run out of steam and they run out of the number of eggs that are viable and all of that at some point. But the adrenal glands are in place to kind of kickstart and take over at that point. Unfortunately, the majority of women have spent the majority of their adult life running their adrenals ragged. They don't sleep. They're stressed out. They don't eat properly. They're just on the go. They're not drinking water. They don't have enough salt. They're not getting enough minerals. And so when it comes time for the adrenals to kick in, they're like, forget it, babe. We're done. And it's like, you're going to have, these horrible symptoms because the adrenals can't give you anything. And so then they're like, well, my ovaries aren't working, not realizing that now they should be really hyper supporting their adrenals to try and get their adrenals to work as best they can. And so what allopathic medicine does, once again, is let's just cover up the symptoms. So, okay, you've run out of estrogen. Let's give you estrogen. And so they the worst that I have seen with this is women who go and they get these estrogen pellets put in. Oh my gosh, because there is no removing those pellets. And so, and not everybody's pellets will melt away at the same rate. And oh my gosh, I've had multiple women who are postmenopausal, not having periods whatsoever, that then ended up having postmenopausal bleeding, thickened endometrial lining, hyperplasia, and cancer in their uterus. And it's so concerning for me that these women are having to go there. And I'm like, okay, when somebody comes to me with postmenopausal issues, I'm like, okay, let's break it down. Yes, let's address your symptoms to give you some relief, but let's see what we can do to get to the root cause of this so that after you get through this initial part of difficulty and we've softened that blow a little bit with these kind of smaller things like vaginal bombs and flaxseed to give you some natural estrogen, stuff like that. Let's look at your adrenals. How can we support your adrenals? How can we make sure you get enough minerals? What are your vitamin deficiencies? What are your allergies? What does your thyroid look like? And trying to supplement on all those angles to try and just help the person support their adrenals as much as possible. And what I find is that when you do that, and especially when you add in things like cold exposure and breathing and all of these things, that woman is able to sustain and to thrive much better than somebody who is like, oh my gosh, I've got to take all this estrogen now, and I've got to take all this progesterone because I'm taking all of this estrogen to prevent myself from getting cancer and blah, 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 blah. And it's just this never ending thing. So it's really, really challenging.
Well, and I think that that's one of the things that people come to me, mostly kind of friends and acquaintances, and they're like, what do I do? Like, do I go on hormones? And obviously this is not my area of expertise. And I'm always like, so I'm so excited when I met you because I'm like, oh, I have the perfect doctor for you to talk to because she can help you. Because I'm like, I know that our bodies have a rhythm and a natural process. And the fact that our ovaries shut down production of estrogen obviously happens for a reason. So this idea, exactly. And then, but women are so miserable, and they're asking me but I'm so miserable. And I'm like, I get it. But that makes so much sense that your adrenals take over after you go through menopause, and that and obviously most men's adrenals are shot too, basically living in modern society. But that makes so much sense, this idea of supporting your adrenals so that our bodies can naturally do what they're designed to do, but most of us are just too stressed to have the reserves in our adrenals when we go through menopause.
And I think just, Katie, like the idea of stress is it's just this all encompassing thing that the majority of people on this planet are totally stressed out. And when you think about, okay, if you can spend 5 minutes and rather than focusing on everything that's bad, if you focus on gratitude and everything that's good in your life, like everything that you're blessed with, the majority of our problems, especially in the United States, for most people are totally first world problems, right? If you take the exact same individual and you put them, in Africa or in India or in Sri Lanka, like they would be considered like so blessed. And it's just a matter of kind of what we've been conditioned to believe is normal and how we should always respond to a situation. So if you take two people that are undergoing the exact same thing and you have one person who is constantly focusing on gratitude and you have the other person who is in the exact same situation and is constantly focusing on the negativity of the situation and how they're so miserable because they're just being persecuted, then naturally your body is going to respond differently. It's going to, respond with different hormones, different chemicals, and the way that your body responds, it goes into fight or flight versus being in a relaxed state where its immune system can actually function properly. So much of that, like those are also things that I was never taught in allopathic medical school, like teaching people how to actually just stop, breathe, focus on gratitude, and let's see if we can keep you in a higher mood all throughout the day and see how that impacts all of your problems. So,
well, what's interesting is that I think that there's something in this that is, it's like a self-perpetuating cycle because what you're describing, it takes time, not a lot of time, but it takes pausing and it takes taking responsibility for like the health of my body is my responsibility. And that may mean that I need to shift my lifestyle in order to take care of my body so that it can get me through, a full lifetime. And we've been conditioned to think that that is weak or that is not, what, like you should be able to take a pill to just solve any problem. So we've conditioned women and men too, but to think that everything should be fast. Everything should be easy. You get sick, you should be able to take something and get better overnight. And the truth is that natural healing, holistic healing, really getting to the issues that are underlying any condition that we're experiencing requires responsibility and really shifting things. And I think people don't necessarily want to do that, just to be honest, because you think in this space where, everyone that I see has cancer, you would think that it would be easy to say, oh my gosh, of course, I'm going to make these shifts because I need to. And people do, but they do. And then they're like a month later, they're like, really? Do I really need to eliminate sugar?
Right. And can I start eating sugar now, please?
And do I really need to sleep? And it's just like, so, and the thing is, I'm not bashing anyone because I'm the same. I'm a human and I've been conditioned into all of this and had a baby and took 5 days off and went back to work as a resident, which is just insane that anyone let me do that. But so I'm not bashing anyone about this. I'm just saying that when you are looking for answers to solve the underlying problem, this is not going to be fast and this is not going to be quick. And some of the things can be these little shifts like gratitude and slowing down, but it requires you to recognize that the lifestyle that we are living as a whole society is making us sick, and that we have to start to make different choices in order to create true health.
Yeah. And I think there's a lot of, just in general, right? People are stressed and it's not always an easy time financially. People have different responsibilities, and they're like, well, that may work for you, but I have to do, like, I absolutely have to do this, and this, and I don't have any energy, so coffee is my only way, right? Or sugar is my only way. But it amazes me, like, when people can find a way, like, even if it's reducing and getting there slowly, when people do find a way to make these changes, as insignificant as they seem, I'm always blown away by how much better they feel. And it may not be instantaneous, but definitely as they're moving forward, they're like, wait, there's a shift, like something's different. And so it always, even if you're just making millimeter shifts, every single one of those millimeter shifts adds up, and it's so worthwhile, because anything that you could do to step in the right direction is a movement in the right direction. So
Absolutely. Yeah. And I like, one of the things that I always say is progress over perfection, because a lot of people want to jump in and do everything right. But you're absolutely correct that the ones who are able to make those changes and then sustain them to actually really experience the positive benefits, oftentimes it's just the little things. If you can make one change at a time and make it stick, then you can add on to that. And then you get a little bit of, you're feeling better. So you're like encouraged, right? Rather than this all or nothing approach. So I love that you say that. Is like, it is actually, and especially with things like what you're describing with the hormones and with, your cycles, like doing the little shifts and then paying attention. It's like an experiment. We have our bodies, we can check and what's happening each month. It's beautiful because the body responds to everything that we do. The body really will shift and respond as you make those changes.
Yeah, it's so beautiful, especially if I have patients who are actually charting their cycles, when they can see the shift from, wow, I had 3 days of tail and brown bleeding last month, and this month there's like 1. And I'm not having as much pain. And they're documenting all of this. And typically, if you're not charting, you might not remember what even happened last month or the month before. But when you are charting and you're writing down those little details, then you can look back and it's so obvious. What I think is really cool about charting too, especially when couples are doing it together, and say like sometimes the woman is like, I am so overwhelmed with this charting, especially in like infertility cases. And I'm like, well, why don't you let him chart for you? So every night, his job is to ask you the question, what was your most fertile sign? And then he writes it down. That gives those guys so much insight. So they have a total understanding of when their wife is fertile, when their wife is not fertile. So they don't ever have to ask, hey, is it time? Is it time? Should we be having sex now? They know exactly when the right time is. And then they also know, especially if their wife has hormonal dysfunction and their progesterone is dropping, so they might be dealing with some PMS symptoms, they know exactly when to buy her flowers. They know exactly when to like do the dishes, take the trash out without being asked. They're like uber supportive because they have an understanding of exactly where she is. And it's like the most amazing thing, because these couples are so connected on this completely different level. And there's just so much love and understanding and support. But it's out of him understanding her bleeding patterns and her mucus patterns and her length of cycle. So it's so, so beautiful.
I love that. I love that just because you're taking something that is a burden and then creating something beautiful, like a beautiful opportunity out of something that's a challenge of, dealing with infertility. I love that.
Yeah. So great.
So I could talk to you for hours, and for sure we're going to bring you back to talk about other things related to hormones and women, especially. I think it would be really helpful with, so many of my women are basically forced into early menopause through chemotherapy or those kinds of things. And some of the things that they can do after they've gone through that process to like support themselves and, support their adrenals, I think would be a really helpful topic to talk about. But tell people where they can find you, because I know that people are going to want to come see you. So please tell us how to find you.
Sure, absolutely. So my website is naturalwomenshealth.com. And I do have a YouTube where I have a lot of little short clips of different scenarios and things that I kind of talk through. Um, I do some public speaking. I'm available. So I am licensed for Pennsylvania, but I do have kind of a coaching practice as well, where if somebody, in another part of the country or another part of the world just wants to kind of run scenarios by, I cannot write any labs for those people. I cannot actually be your doctor, but I can just give you advice, like a friend or a coach would give you advice. And so those things are all available, and it's all kind of documented on my website. So naturalwomenshealth.com is the easiest way.
Perfect. And we will link in the show notes. So thank you so much.
Awesome.
And it's always a pleasure to talk to you.
Oh, you as well. Take care. God bless.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you. And I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal.